I would like to introduce our guest speaker tonight. I'm so grateful to be joined by Emma, who is a specialist clinical scar massage therapist with over 30 years experience in the field. Emma's a leading educator in scar therapy, regularly teaching healthcare professionals in the NHS and private practice, as well as presenting on scar tissue at UK and international conferences. So welcome, Emma, and thanks again for talking on such an important topic. I think we hear so many queries about scars. Obviously, most people, I would say the majority of people that get breast cancer diagnosis will undergo some form of surgery, whether that's a lumpectomy, a mastectomy, reconstruction, or surgery to their armpit. And we often hear about sort of from people who have queries around scars. And as well as sort of just, I suppose, the topic we're going to be talking around is massage. It, for a lot of people, sort of touching scars can be really quite difficult in those early weeks and months. So we do get lots of queries about that. And we've got some information on our website around that and some sort of tips that people might want to sort of go through, which we can touch upon if we've got time a bit later. So I think a really good starting point, Emma, from you would be just to talk about sort of what scars are and how they're formed.
Yeah, of course. Thank you so much. It's lovely to be here, and really looking forward to sharing a bit of insight to everyone listening. And I think when I find people hear the word scar, they're often thinking just about what's going on the skin surface, but scar tissue forms internally as well. So when we have a surgery, but also radiotherapy can cause scarring as well. So when we have surgery and or radiotherapy, we're damaging layers of tissue depending on how invasive your surgery is. So somebody who's had, a major flat reconstruction to have, a new breast taken from another part of their body, they're going to have really significant scarring in more than one place. Because first of all, the tissue's sort of traumatized as it's cut during surgery. And then what you get is a normal wound healing. So we have an inflammatory stage, which is when things get really hot and swollen and painful. And then that is awful and really uncomfy for most people, but it's a really important thing because it's your body's way of triggering the repair. So inflammation, while it's really unpleasant, is actually a good thing. We just don't want it to stay for too long. So we need a little bit of inflammation at the beginning. That's good. And then we ideally want that to kind of calm down. So then your body starts repairing cells. And unfortunately, the body doesn't do a like for like fix. So it's a bit like, your body's sticking a bit of super glue to on some beautiful vase that's broken. So everyone's always going to know that it's got damage on it. And some people, the way that they scar because of their genetics, skin tone can make a big difference. So people with darker skin tones can often, for genetic reasons, end up with thicker scarring. And the location of the scar. So scars that are under a lot of tension, so when there's a lot of tissue removed, can also end up slightly bigger scars. But even things like a very neatly done lumpectomy where somebody's, your surgeons managed to make a tiny incision on the surface, can have some hard lumps of scar tissue inside the breast, which obviously can be quite concerning. It can be quite painful, but it can also be a worry because you're trying to check your breast for lumps and it's a bit lumpy because of scar tissue. So if we're able to reduce that a little bit, it can be a bit more comfy, and also it can make the individuals that I see less anxious because they've got less hard lumps inside their breast as a result of their surgery. So I think, while we know that we can't avoid scarring, hopefully some of the things I'll talk about tonight will be about how to make the scars that you've got as good as possible, so as soft as possible, as limit the amount of pain that you've got. And if you've got thickening, whether that's thickening like it feeling a bit lumpy on the top of the skin, or whether that's thickening feeling like you've got some lumps and bumps under the skin, those are all things that actually some massage can help. And so that's kind of what I want to share. And some people have been told by their surgeons to massage their scars really, really hard. But I think you'll remember when I said at the beginning about how inflammation is the first trigger to get scar tissue. And actually, in my professional opinion, really aggressive scar massage isn't good for people, and that the scar tissue is more likely to reduce if they go a bit more gently. So hopefully if somebody was watching today and they're feeling a bit nervous about massaging their scar, I'm not going to be recommending things which are uncomfy for you or painful for you, because I don't actually want to make your body have lots more inflammation, which when we have pain, when we push on something too hard, it can get inflamed. And that's just because, there's some old school thought that's still sort of sitting around within oncology surgery about how to do scar massage. But I can tell you, as somebody who's really up to date on what we should be doing in scar massage, it is my true belief and experience of many, many different types of surgeries that we can get results without having to be too aggressive.
Yeah. And on that point, Emma, would you say, because that's certainly something we hear on the helpline, and when I was in practice as well, was sort of the surgeons would say, it's really good to help with the scar, sort of, you need to start massaging. When would you say is the ideal time? Because we often, and again on our helpline, people will say, I've been told to massage my scars, but I'm not quite sure at what point I need to do that.
So I think scar massage should start as soon as you can once the scabs are gone. So I think if your pain levels are tolerable enough that you can start getting some touch in there, that would be really good. And one of the things that I might say is, if people have got something like a face cloth at home, if they're finding that it's super tender and also perhaps they're a little bit nervous about touching it directly, they could put the face cloth over and just start with like a gentle padding, a bit like you're trying to send a little baby to sleep, because that is baby tissue. It is really new, gentle tissue. And if you think about how gentle you'd be with a newborn baby's skin, well, that's what you've got. And so I think starting massage early is a good idea, but maybe just start with something really soft and gentle, just some gentle kind of like getting some pressure on, getting it moving, and then maybe just sticking on the skin and just moving the tissue up and down. And if that's uncomfortable for you to do directly on your skin, using something like a face cloth, and you can start with it doubled over and then you can get it a bit thinner, and then maybe you'll feel all right to touch it directly, can be really good. Or the other thing that I really like is you can get these little silicone sort of, they're like silicone facial things, and they need to be really soft. So not, if you're pushing on them and they feel really hard and knobbly, that's not the right one for your scar. And the good thing about these is that they add a bit of grip. So when you have a scar, I've got some really badly sewn together bits. So when you have your scar, this is like your skin layer.
Yeah.
And then you've got what's called your sort of fascial layer underneath, which is like a little thin layer that helps our tissue glide. And then we've got whatever's under that. So it could be some muscles and things like that. This all gets stuck together. So where it should all like move nicely, we get this kind of sticking of those different tissue layers. So I really like this kind of grippy one because it actually sticks on the tissue and it makes it slide back and forwards. And that's more important than just putting loads of oil on and smearing it around where you're just rubbing the surface. So actually, if you can get your grip on your skin and slide your skin backwards and forwards above whatever's underneath, just really gently, not pushing it as hard as you can, but just little skin slides, that would be really helpful to try and keep mobility between those layers. Because if you think about something like the wrist, if you look at the skin on your wrist, it needs to move as your joint moves position. Well, if you've got a scar on your breast, as your arm goes up, not just because of perhaps surgery under your arm, but if you've had a lot of tissue removed here, as your arm goes up and this is starting to stick, it's all going to get really tight around wherever the scar is. And so if we get that skin layer moving on top of the deeper layers, that can really help make movement more comfortable, make the scar feel more comfortable, and be a really great thing to do anytime from the minute your scabs have left. Just only for a couple of minutes a day, don't overdo it. Go gently, and if anything starts to look red and sore, stop for a few days and then restart once it's all calmed down, because it could be you've just gone a little bit too hard.
Yeah. And I think the point using like a face cloth is really a good point. And I think for some people that, again, we hear in the weeks and months can really struggle to touch their scars because they're just, one, they might feel afraid of what it is sort of that they might cause damage, but two, just afraid of what it feels like and what's there. And it's a period of adjustment. So whether that's almost that sort of a staged approach to slowly getting used to touching the area before you're able to do that with maybe your fingers is a really sort of good tip, I suppose. And
And
again,
some
you
people
talk,
find it easier to do in the shower. So I've had some women who said to me, like, I wouldn't normally rub my breasts when I'm not in the shower, but I would normally rub them when I'm washing them. So it's finding what's appropriate for you. What do you feel comfortable with to start off with? I think at some point it's quite good to do some massage once you're out of the bath or the shower. But if that's the right stage for you, just touching itself and just moving that skin, even the tiniest little bit, is really going to help your healing.
yeah. And about the sensation, again, so many people say that it's, and hopefully I think we're getting better at it, but I think that loss of sensation or that altered sensation you can get with scars is really sort of quite tricky. And I think we did have a question that came in, which was I've done with it now. I say it was. I think it was. A scar area is still very sensitive even after 16 months of after a lumpectomy. Please advise,
Yeah.
from Monica.
So I always think if it's around the breast area, the first thing I'd check is like what you're wearing and whether or not that's irritating it. So definitely take a look at your bra setup. Ideally, have a bra with a nice broad band underneath, and that's really not going to actually be irritating your lumpectomy scar during the day. So I think if you're a lot of people don't necessarily go back and get remeasured after a surgery. And I think that having the right garment on, because if your tissue is getting irritated, that's not going to help. If you start doing some touch work with your scar, so as I said, just try the working over a face cloth or with the little silicone brush, that can be really good to help build up tolerance to touch, because it can be almost like your nerve endings have become super sensitive, and therefore if something's super sensitive and we stop touching it, any touch is then going to really set off the fireworks. Whereas actually if we introduce more regular touch to an area that's super sensitive, it can start to realize that touch is okay and the nerve receptors can calm down. But it isn't going to happen overnight. So I think what I generally say is start with a program of, if you can, for sort of 20, 30 seconds, just do some really gentle touch over the area, and then see if you can build that up to a little bit longer, and then vary your touches. So you might start off with just a static hand, putting some weight on it if that's all that you can tolerate. And then you might find after a few days you're finding that a bit easier. Well, then you could start just putting some pressure into that hand, so just a really gentle pump. And then maybe a few more days later, if you're finding that okay, what about a little rub or some gentle tapping, so that you're introducing different stimulations. And all of those different stimulations do slightly different things. So if you've still got a lot of breast tissue, this is a prosthetic that I've got, which is, I think, quite a nice one. But our breasts, if you've got even quite small breasts, that breast tissue that remains is quite nice, and it responds well to touch in a way that if you put a little bit of tapping through it, it will send a bit of ricocheting movement through it. So there'll be a bit of vibration going through your breast. And actually, that vibration, as it goes through our tissue, or oscillations, another word for it, what it does is we've got in and around all the little cells that are in your body, you've got lots of fluid. We've got lots of fluid inside us everywhere. And the vibration, as it would do on water, will kind of ricochet through those fluids, and it can actually help fluid movement. So it's quite good for just actually getting things going. So if you were concerned about any kind of edema, or any thick, if your breast feels a bit thicker on the bottom, some people end up with like a heaviness in that bottom part of their breast, particularly if they've had radiotherapy. And sometimes that's because if they've had lymph node removal and they've had radiotherapy, everything's got a bit stagnant in there. So having some vibration in that area can be really good, because it can help gently move it. And I'm not talking about really hard, just some gentle kind of finger drumming around your breast, a bit like little raindrops. That would be really nice, just to get things moving, together with some nice sweeping strokes. And those things can be really good, not just for sensation, but also for just encouraging fluid movement in and around the breast area. If you've had a mastectomy and you've really got quite not a lot of tissue, you've just got quite a bony chest, I think that percussion movement wouldn't feel very nice for you. So if that's describing your sort of your chest at the moment, if you've just got like a mastectomy with no reconstruction and there's no breast tissue, I think the percussion might be a bit irritating, because it's almost like doing it straight on bone, which won't feel very nice. And all the time we're trying to get a balance right between getting some stimulation but not causing irritation, because that could actually make pain worse.
And is there something as an alternative for that scenario, Emma, that if somebody has had
Yeah,
a
so if somebody's got a really sensitive chest and they've had a mastectomy, which I see a lot, and particularly again, I'd say think about your bra setup, because sometimes the bra's raising up and rubbing on the mastectomy line, which I know can be really uncomfortable. So there's little things you can do, like just get some like silk or satin and put that inside the bra, so if it starts moving up, you've got something really smooth, and rather than a more abrasive cotton rubbing onto your scar line. And the other thing is probably more flat movement. So I think either doing it with your hand or with the face cloth or with the silicone, just getting that skin movement, because that can feel really tight. And if you've got a mastectomy and you've had quite a large bit of tissue removed, so you had a reasonable sized breast, you might find that you're really tight with your arm movements because you've had so much tissue taken away, and that pulls on your scar. And one of the things I'd say is, if you're going to do your exercises for just arm movements, start off by just holding above your scar and just doing some small stretches, just to stretch the skin around your scar before you stretch onto the scar. And that can make that a little bit more comfy. And that would be the same advice if somebody's got some cording or they've got a big scar in their axilla that they find very painful when they lift their arm up. Just first of all, do a smaller movement and block your scar and just stretch it, and then do a bigger movement. So do the full exercise, but just warm into it. So you're just easing the pressure on the scar. Because if you imagine, if all of this is tight above your scar because you've been looking after it, because this is a more comfy position than being like this, and you've been protecting it so nobody hurts you. If all this gets tight and then you've got a tight scar, you imagine all of that stress is going on your scar. So if we open this up first and then we ask the scar to stretch a little bit, we're reducing the amount of tension that we put on that really sore bit of your body.
Yeah, great, thank you. And just a couple of sort of signposts on what we've spoken about. One about sort of bras, we've got information on our website about post-op bras that people can have a look at, and Kev may put it in a link in the comments section, or I can get that posted tomorrow. And the other thing to say is we do know that some people will experience ongoing pain and discomfort, because we know that surgery disrupts the nerves, and radiotherapy can also impact on that as well. And I think if people have got ongoing pain, and if they've tried the massage and it's not working, we'd always say go back to your treatment teams, let them know you're struggling, because they can signpost you on for additional support, whether that's pain clinics and things like that. So do feel that it's not something you've just got to sort of manage at home. Do let your treatment teams know, or give us a call and we can chat through it on the helpline. Somebody's asked, Irene's asked, what are your thoughts on dry body brushing? And I don't know if that comes into any of your remit, Emma.
Yeah, so dry body brushing is really popular. It helps with the lymphatic flow, so it can be really good. I think use it under advice if you've had full lymphatic clearance, because I think it's important that you do it following the advice of somebody who understands the lymphatic system, rather than, there are things out there on YouTube and Facebook that aren't that can provide actually advice which could be dangerous. I think, unfortunately, we're in a world now where it can be overwhelming, the amount of advice that you read. And so I would be happy for somebody to do things like body brushing, which helps to promote lymph flow and reduce swelling and edema. But I think doing it over the breast area, you need to be quite cautious, especially if you're numb. So two things is, if you've still got quite a young, fresh scar, doing body brushing over it, I think, would be too aggressive. I think that the body brush would be literally just damaging that really new tissue, which actually could increase pain or cause an inflammatory reaction, which actually would have a counterproductive effect on what you're wanting to do. And I think if you are going to do body brushing and you have got some numbness in the areas you're going to do it, do it the other side of your body if you haven't had bilateral surgery and you're not numb in both places, so that you can actually feel what those sensations are like on a breast with full sensation. Because a lot of people, when they've got scars, because they can't feel as well as normal, they then go deeper. And so if I'm showing somebody how to do some massage, I tend to say, try it on your hand. This is the pressure I want. You don't need to push very hard to get your skin to slide. And that's all I want you to do. So I'd be a bit cautious doing the body brushing directly over the breast area. But I think as a general routine, it could be nice. But be aware of where you've had lymphatic disruption, because if your body's already working on overtime because you've had a big surgery, and then you're sort of sending more water down through an already flooded river, that's putting strain on your system. So I think if you were already body brushing prior to a surgery, then that would be great to keep it up. But I think I'd be a bit cautious immediately after a surgery or in the first few months. But if you're much later down the line, it's potentially not a bad thing to do. And the other thing that I really like, but again, I'd only go with these really small sets, is these are silicone facial cups. And they do come in bigger sizes, but I would suggest you've got much more chance of injuring yourself if you use anything bigger than this one. So if I put up my finger, the big cup is about the length of your index of an index finger, and the small one really is very, very tiny. So the small one is smaller than my little finger. And these you put onto the skin, and they just take a tiny bit of suction and lift the skin up. And this one can be quite good for like around a nipple area. If you've had surgery and your nipple's kind of folding in a little bit on one side, or where the scar's been, maybe around the nipple, it's kind of like more closed. These can be quite good just to create a really, really gentle lift. I wouldn't do it earlier than 12 weeks if you're trying it at home. So I'd try it after 12 weeks. So that, and if you've had a bigger reconstruction, you might need to wait a little bit longer, because you might have a new blood supply under the area, and we've got to be really careful with anything while that all gets together. So maybe if you've had a big flap surgery, maybe wait till after 16 weeks. But then after that point, it should be fine for you to keep going. And then this other one does a slightly bigger suction. So you'll see that it kind of sticks onto my skin a little bit, but not so much that I can't pull it off. And the more you squeeze, the stronger it's going to be. So if you were going to start with these, start with a small squeeze, and then you can gradually put a slightly bigger squeeze on it. And this is really good, because a lot of people, they massage themselves, and actually, particularly if you've had something like a lumpectomy, or perhaps you've had a flap surgery and you've got some hardened necrotic tissue in there, so you've got some heavy feeling lumpiness. Actually, if you're trying to do a massage with this or with this, you could say to me, Emma, that really hurts, because actually there's something lumpy in there and I'm squashing it. But you might find it very much more tolerable to put this on and then just do some little circles, because you're actually lifting rather than pushing on the breast. And that can be much more comfortable. And it still means you're getting really good massage, because when scars form, they're all quite compacted. Everything's kind of like all knitted and squashed up together. And using a very gentle suction, we can actually help to separate things. So it can help soften even that internal scar tissue by helping to separate those layers of tissue. So it can be good after mastectomy without reconstruction, a flap surgery, including wherever your donor site scar is. So that could be along the tummy after DIEP, or it could be if you've got somebody that can help you after a latissimus dorsi flap, a lap flap, or if you've got some flaps, surgeries from your legs. Can be a bit awkward getting the contours right, but it can be quite helpful. And some people find these easier than manual massage.
Would you just go along the scar then, Emma? Or just...
Yeah, I'd go along the scar, but I'd also work on it. I think so if, let's say this was like a really tiny lumpectomy where you've perhaps only got a little bit of scarring around the nipple, you've got to remember that that's just the entry point. And actually there might have been poking in the breast somewhere over here. So when you feel your breast, you might say, well, the lump's here, but the scar's here. So I would be doing some cupping with the little cup around here. And then I'd get the bigger one, which is going to get a bit more of the deeper tissue. And I'd do some over the area where you feel that the hardness was, or where you've got lack of sensation, or where you've got a lot of sensitivity issues. So if you can tolerate it, what that cup does is it brings a little bit of blood up to the surface. So you should see a little bit of pinkness come, and that should then fade. So if you use the cup and when you take it off, the mark of the circle stays there for longer than 30 seconds and it doesn't go back to your normal skin color, you've sucked a little bit too hard. So stop for today and try again the next day with a gentler suck, because it should be that your body can tolerate bringing blood up to the surface, and then it can tolerate letting it go again. And we know that if we, from bad teenage years, we know that if we suck on something too hard, we end up with a little red mark, and we don't want that, because that means your body has had a little bit of damage. It's got actually some leaking of the blood into that area, which we don't want. So just gentle pulsing. I would only hold it up for a second or two. So just a gentle squeeze so it lifts up, and then a squeeze to let go. So you put the cup on, you squeeze to lift up, squeeze to let go and come off, and then lift it all the way off so you can look at the color the first few times. So do it in front of a mirror, or ask a friend or family, partner or family member if they could have a go with you, and just keep an eye on it the first few times. And once you're confident that you're not causing any damage, then you should be fine doing it without the mirror there, because you'll get used to how much to squeeze.
Right. And where can you get them from? Can you just buy
So
them on
these
Amazon?
are on loads of online places. So if you just Google on like online shops like Amazon or eBay, silicone facial cups. And like I say, you can get glass facial cups. They're a lot stronger. These are the only ones I'm advocating, because these are gentle enough that I know you won't hurt yourself. But once you start with anything bigger or anything stronger, you could actually pull your scar apart, or you could be causing more inflammation, which could end up with more scar tissue. So I'd only want you to go with something stronger if you were recommended by a professional. So I think, and if you tried any of the massage that I'm recommending today and anything gets more painful, more sore, or you notice more swelling, go back to your medical team and stop doing that. This shouldn't create more discomfort. And if it does, it's probably that you're doing it too hard. I think most people think scars need to be massaged really hard, and when they come for an appointment, they always say to me, "Oh, is that it? Oh, I could fall asleep." And that's what you're looking for. It should be soothing, it should be slow, it should be calming, and it should be gentle, because that's all knitting together, and it doesn't need you to hurt it. It needs you to give it a little bit of gentle TLC, like you would on your face. We don't want to push our face too hard. So I sort of say the first press you should start with is a bit like how hard you'd push on your eyelid. So if you were just going to do some really gentle work over it, think about how hard you press on your eyelid. And you don't want to press that hard, because we only just want to get a little bit of movement in that upper skin. And then you might move on to how hard you'd press kind of over your cheekbone if it was like a mastectomy without any reconstruction, because there won't be a lot of tissue there. And then if you've got some kind of reconstruction, it's more like your cheek. So you can go in a little bit deeper because you've got a bit more soft tissue. So new scars, mastectomy with no reconstruction, or anywhere over a bony area, if you've got some breast there, including a breast which has got if you've had an implant underneath, you've got to think about that as kind of needing some different attention. So you'll have the layer of superficial tissue, which is actually quite thin, because you've had your breast tissue taken away. So if you've got an implant in your breast and you haven't got any breast tissue on top, that just needs some quite gentle work over the top of the implant. But round where you can feel the edge of your breast, I'd do a little bit more deeper movements, because what's important is where your implant is as you breathe, your ribs expand, and they can get so stuck that they're stuck on your ribs. So it can then hurt to take a deep breath. So one of really basic massage move for anyone after breast surgery is breathing, because when you breathe, all of your scars get massaged from the inside, as long as you're breathing in the right place. So if you touch wherever your chest is and you breathe, you want to feel that moving. And if you're only getting movement either above your breast area or below your breast area, that means that bit isn't getting massaged. So doing some work around here, and if you've got that implant, and just doing some daily deep breathing, it's the most fantastic exercise. And particularly if you've got a lot of pain, because breathing is really good we get in fight and flight mode when we've had all the stress of cancer and all of the stress of surgery, and we end up taking much shallower breaths. And particularly because maybe at the beginning it did hurt to take a deep breath, but we need to get back to that nice, deep, slow breathing in order to help really encourage movement of the ribs. Otherwise, our back gets stiff and our neck gets stiff and the scar gets stiff. And we need to breathe to get your lymphatic system moving. So if you've got lymphedema or you're worried about having lymphedema, just taking some deep breaths are really crucial. And just build it into your routine. Set a little timer on your phone. So twice a day, you're going to do 2 minutes of deep breathings. You put your little timer on, you go, I'm just going to sit in my chair and I'm going to breathe and touch your chest so you can feel those nice breaths coming in. And you can see I'm quite good I do a lot of practice with my breathing. So you should see with me that when I breathe, everything moves. It moves outwards from the side as well. And that takes a little practice. You might find that when you breathe, you're only moving here, but if you keep practicing it, it will get easier.
And I think that reminds me, takes me back to when I was in clinical practice. I'd see patients on the ward post-operatively, and particularly when they'd had implant-based reconstruction, they'd almost say they felt like they were in like a vice-like or an internal bra, and they just didn't have enough to take a big deep breath in because everything felt so tight. So I think that's really important about sort of slowly building that up, because it's so true. You'd hear people saying, I just don't feel that I can expand my chest enough because it's so tight after surgery, and that's easy over time. So really important.
And if somebody's had surgery just on one side, your body can actually do more breath normally into the other side. So one of the things you can do to make the side that's maybe had the reconstruction on it to have that breath is if you breathe lying on your side. So if you lie down in bed or on the sofa and squash the other side, that means your body's forced to do more expansion into the side where the surgery's been. So that can be quite a good tip just to get you into training. And then once you're able to do that a bit more, then you can just breathe in more normal positions. But actually lying on your side forces a little bit more air into that side.
Yeah. And just going back to the sort of massaging with your fingers, is there a particular way? Is it sort of circular motion? Is it sort of walking the fingers along, or is there just not a definite way to do
I
it?
think there's lots of different techniques that you can do, and so I know we won't have time to go through everything today. Is just to mention that there's a free app called Oncio, ONCIO, and there's a 7-day program that I've done that people can watch in how to massage your scar, and they go through step by step with lots of different ideas. Because I know that you also wanted me to touch on like the creams and gels, which I'll talk about in just a sec. But I think what people forget when they're thinking about massaging their scar is particularly once they put like some cream or some oil on, is that they're just sliding over the surface of the skin. And I think that's important. And it is really, really important to get some moisturizer on your scars. But what's also important is to get your scars to move. So my recommendation for the clients that I see is, have your shower, and if you want, do a little bit of massage or something in the shower, and then either over the towel, because the towel's quite good for being grippy, or with your hands. I just want you to move your skin. So wherever that scar is, you want the skin to move over the area. And if you do that dry, you're sticking on the skin and you're dragging the skin backwards and forwards. Whereas if you put moisturizer on, you can see my cheeks not moving the same way. So what we want is a little bit of that skin wiggling.
Yeah.
So we want some traction between the layers of skin. And so that's hard to do once you've got something really slippy on your skin. You just slide over the skin, which is also really nice. It's a comforting move and it's also stimulating to the skin. But the worst thing that happens with scars is everything sticks together and everything gets a bit tight. And so partly what we want to do is do some little stretching of those different layers. And we can't do that once we've got too much oil on.
Yeah. Yeah. Thanks for that,
Hopefully
Emma.
that helps.
Yeah. And so I suppose that moves nicely on to, we often get asked, what do I moisturize with? Is there a particular cream? Have I got to buy something special, expensive? Is silicone gels, silicone pads? It's a minefield, I suppose.
It is a real minefield, and I can totally appreciate how overwhelming it is. Everyone should be doing moisturization, full stop, after your scabs are gone. Everyone. Doesn't matter, even if you've got, and it's not just about making the scar look good. It reduces inflammation and it helps to reduce itching. because sometimes your scars are really itchy because they're dry, and dryness in the skin can cause pain in a lot of individuals. So something as simple as starting moisturization once all of your scabs are off needs to be something that's really basic scar care that unfortunately isn't getting given to everyone. Um, Personally, I prefer products which soak into the skin, whereas sometimes there are a lot of cheaper products which sit on the surface of the skin. Things like Vaseline or E45 tends to be a little bit more oily and sits on the surface of the skin a little bit longer. And I think when you've got a scar, you also, particularly if you've had radiotherapy, you want something that's got a little bit more sort of soaking in, because radiotherapy can be a bit like having sunburn. So what you want is something that's really cooling and soothing and calming, and a little bit more liquidy than if you've got like a mature scar and you haven't had any radiotherapy. So I think have a look at your skin type. You've also got personal preferences. Some people hate to feel oily and some people love an oil. So that might depend on what you like. There are, in terms of oils, one of my favourites is the Balmonds oil. They sell this in Holland and Barrett, but they also sell that online. And this is actually made by a lady who was like a small British company, and her daughter actually had quite bad scarring after a burn. And so she developed this oil. It's really natural, and you can pick that up in a pharmacy or in a health food shop. You could just buy some nice rosehip oil, and something, either one of these would probably last months and months and months. You only need like a couple of drops. Definitely use it on your face when as well, because they're really good. It's a thin oil, so it's not heavy. It's not going to sit around on the top of the skin for very long. So rosehip oil is well known for scars, and it should soak in quite quickly. So it shouldn't mark your underwear and things like that. Within a few minutes, it should soak in. And if you've got lots sitting on the surface of the skin, you're probably putting too much on.
And
And a
could
lot of people
go on.
mention bio oil to me, and if you've bought it, use it, but it's not my favorite. But there are personal preferences, and some people love it, and if it's worked for you in the past, definitely continue with it.
Yeah, I was just going to say, is something like olive oil or coconut oil any good, sort of, or just sort of just or
Yeah, I mean, olive oil's definitely thicker, and coconut oil, the odd person can have a reaction to it, but they're very affordable. When it comes to kind of like looking at research and things like that, because I try and be really well informed of what's the research saying. There's loads and loads of history of people using natural oils for scars, and the ones that historically and in more modern research come out well is rosehip oil. That is really well known, and there's even like a special scar oil from this company Naki that do they do a 2-stage. So you use this slightly thicker one for the first 2 weeks, and then you go on and use this finer spray. And again, those are like specifically developed, all of the ingredients in them are for scars. And whereas like the other rosehip oil, could be put into a massage oil, could be used as a facial oil. They're
yeah,
just generally really nice. So I think oils are really good. And inside your skin, you've got a kind of fatty layer, and the oils are more likely to help repair that fatty layer quicker, which is one of the important things our skin needs. But an oil isn't actually delivering any moisture.
right,
It's an oil, so it's a fat, so it hasn't got any like water content. And if you've had radiotherapy, you definitely need that water content because you've got much drier skin. So back to that kind of sunburn analogy, my favorite cream for scars, and particularly after radiotherapy, there's been some is I work a lot with people who like basically do lots of research into different products, and this one on lots of research papers does come out really well to show that it's really good for helping scars heal, including helping burns heal and radiotherapy. And there's been some really great case studies. It's quite unlikely to cause any skin reactions. But if you're currently going through radiotherapy, please don't change your cream now. Changing cream in the middle or immediately after radiotherapy really isn't a good idea. Speak to your radiotherapy team before making any choices, and if they've recommended something that's working for you, trust them. They are experts in what they do, and I wouldn't want to be contradicting something that your medical team has told you, particularly when you're at that vulnerable stage of going through radiotherapy. but also people going through chemotherapy can have very reactive skin and tissues. So I'd say really be on the lookout if you're still going through chemotherapy, and be very careful changing your products, and first use it on an area of skin the way that you might skin test if you're going to have your hair dyed. So put a little bit behind your ear, just check you're not reactive to it before putting a load of stuff on a new scar, because it's particularly with chemotherapy, your reaction to things can be more increased. So we don't want to end up with your sore scar suddenly having a big rash because you've changed cream suddenly. So I think that that's a really important consideration.
Yeah, and I'm really
And then
pleased
we
you
mentioned
mentioned that, Emma.
silicone.
Just to say about the radiotherapy quickly, we've got guidance around skincare on radiotherapy on our website, and we can post a link of that. The
Oh,
Society
definitely.
of Radiotherapists have put, there's recently updated skincare guidance which talks about sort of, as you've said, keeping with what you're used to. Many years ago, they used to sort of just say, don't continue on with what you're used to, but actually the advice changed more recently. So, but again, it's always worth checking with your treatment teams. Sorry to
Yeah,
interrupt.
definitely. No. Um, Silicon's another thing which I would say, if you've got a history of forming really big scars known as keloid scars, or if your scar has started to grow bigger or is really considerably thick, which we often see in people who have got darker skin, but quite often after those bigger surgeries. So if you've had a flap surgery, you might often find that your scar is really quite thick and darker coloured than the rest of your skin. So if you've got dark skin, it might be even darker. If you're fair skinned like me, it might be really quite dark red and angry looking. And silicone is really good. Excuse me, sorry, I'm just getting over a bit of a chesty thing. And it comes in two forms. So it either comes in sheets, which you might be able to see on this, in different sort of shapes and sizes and different colours. Oh, excuse me. And it can come, so like for around a nipple, you can get a round one, or if you've had the big DX scar, you can get a big long one for your tummy. If you've had like more like a lumpectomy scar, you might want to get a smaller one, and it comes in clear as well, so you can just about see the shadow of that, can't you? It obviously doesn't show up so well in the clears, and the sheet is particularly good for those thicker scars, because you just put it on during the day. You need to if you're going to use it, I'd say don't bother starting unless you're going to go for it for at least 6 weeks, because it takes quite a while for it to show results. So I've had some people who said, oh, well, I was using it, I tried it for a couple of weeks, I forgot it a few days, and they said it wasn't doing anything. It's something that's only going to work if you use it really, really, really religiously, and it is really excellent for softening and flattening those scars. So that can be really good. Price wise, the higher quality silicone, if you're going to buy it privately, normally works out at £10+ per week for you to pay for it, because particularly if you've got like that big tummy one, like you could be paying over £100 for a sheet, but the sheet should last you for 8 weeks. So it is an investment. So that's why I say to people, if you know that you're a bit bad with things, you start them and don't carry on, please don't waste your money on it. But if you are going to go for it, the results are really great, and they're most useful in early healing. If you've already got a scar that's lovely and flat and is changing colour and going more like your normal skin colour, that's perfectly fine. Like I would say, I tend to recommend it if people really want to go over and above, or they know that they've got a problematic scar, because it is that little bit more expensive. In some areas of the country, and depending on your medical team, if you've got very significant scarring, you may be able to get silicone on prescription, but I have mixed results with whether or not people are successful. I don't know if you find similar, Louise. It might depend on a bit of postcode lottery.
Yeah, I mean, again, I was going to ask that, Emma. Is there a possibility that it can be accessible on the NHS? And I suppose it is.
Yeah, and
It's a really
similarly, our
tricky
Hydran
situation.
is a medical cream, and some people have managed to get that on the NHS. The other products that I've shown, as far as I'm aware, so the silicone and the Alhydrin are both medical products, and I have had clients who've successfully got them, but they do cost the NHS a bit more, and we know our NHS is on the floor, so it might depend where you are. And then silicone does also come in a gel, so it comes in different brands. This one's got a sun protection factor, which Louise said to me, make sure you mention sun protection. because if your scars, particularly maybe like your port scar, that could very well be exposed to the sun. So actually, if you haven't got a special cream for scars with an SPF, please get some SPF on it, because again, if you think of that fragile baby skin, that's soaking in all those harmful rays from the sun. The thing in our skin that helps protect it from those damaging rays is melanin, and melanin isn't there in scars. So it means that your body absorbs more harmful rays into that area. So we definitely want to get some protection on. And obviously it can burn more easily because it's more fragile. So a silicone gel, it's a clear gel basically. And the thing that people often make the mistake with this is that they put too much on. So if I had, let's say, a mastectomy scar, just a simple mastectomy, a straight line across, I would literally need like a tiny little bit like that. And then what you're doing is, this is designed to sit on your skin surface. So with this, you'd spread it across the scar and then you'd stop spreading it. So what people do that's wrong when they go out and buy a really expensive product like this is they then rub it around and rub it around and rub it around. And I think, well, you've now wasted it, because it's now much thinner on the bit that you needed it on, and you've spread it around everywhere. And similar with the if you're going to buy a more expensive or get on prescription a more expensive scar cream, don't overuse it. If you've still got residue that you're rubbing into your hands and you've got lots on there, or if you've still got a lot of sticky white residue on your scar, you're putting too much on. Everything should be soaked up within a couple of minutes. So don't waste those special products, is what I would say.
And could you get that gel on the NHS in certain
Yeah.
circumstances as well?
Yeah, definitely. Yeah. And I
Yeah.
think the people that are likely to be able to get a silicone product, either a gel or a sheet, on the NHS are people who have got scars that have grown bigger. So they would be talked about as keloid scars, which are really, really like significantly bigger than like the skin surface. So they sit and raise above it. Or people who've got what's called hypertrophic scars. So keloid scars get big, but they also start growing outwards. So if you've got a line of a scar, they start kind of getting wider and higher. And hypertrophic scars just get higher. Lots of people think that they've got a keloid scar, but actually they've got a hypertrophic scar, which is good news, because hypertrophic scars, even without any special treatment, should over time get better. It might take a couple of years, but they should eventually start to flatten. But if you knew you were going to get a bad scar, if you'd start with, the problem is once they flatten, is they're raised above the skin surface, and once they flatten, they end up quite wide. And so if you knew that you were at risk of getting quite a big scar because of where your scar was, or because that started happening in early healing, the sooner you can get that sheet on, or the gel on, the more likely it is that it will not continue to grow, number one, and then secondly, that it will flatten and not be quite as big. And some people just end up with really kind of like thin, wide scars. Particularly, I've seen that kind of around the axilla, where everything's been a bit stretched, and no amount of cream or moisturizer or anything is really particularly going to make a difference to that, because it's just that the skin's had a lot of tension on it.
Yeah.
But they can help. And I think with all of these things, part of it's probably, with the creams, part of it's probably that you're rubbing your skin. So if you haven't got a specialist skin care product and you just start with the massage and just some basic moisturizer that your body's tolerant of, that is going to really help you. And so don't feel that these things are out of your reach because maybe you can't get this on prescription. Having scar massage can also help soften and flatten the scar. It can help with the pain, and it can help with the skin color as well. So even people come to me and they've had their scars been maybe really big and really red for more than a year, more than even 2 years in some cases. And that doesn't mean that with the right stimulation and the right massage, we can get it to kind of like slowly get back to normal. It's just none of these things happen overnight. So it's about just little and often.
Yeah. And I just, because I know I could sit and talk to you all evening, Emma, but I'm aware that we've been talking for nearly an hour, and there's still so much I think that we could go through. But just for people that might be sort of who have tried or are sort of doing that and are still struggling, and I know that obviously you offer private practice, but you do teach healthcare professionals. So, and again, I know that won't be accessible throughout the whole of the UK, but is there sort of what would you say to somebody? Would they go to their treatment team?
Yeah, there are a number of kind of cancer support centres who've who've trained the therapists that volunteer from there. So there's a big centre called the Penny Bronze Centre in Bristol. We've just finished training the Christie team up in Manchester, the Macmillan team down at Bournemouth, over at the Royal Marsden. The team have done training there up at Clatterbridge in Liverpool. We've trained the team up there. So there are some really well spread accessibility to have some professional treatment via cancer support centres. And I think the more they hear that this is a service that's required, hopefully the more they'll invest in making sure that that's a service that's available. So even if it's not something that's available at your local support centre, if you reach out and say, I understand this is available at other support centres, I'd love to see it here. If cancer support centres know that there's a demand, it's something that they're likely then to try and facilitate. And the other thing is that when I do teaching, we have free therapy spaces available for people to come and book into, and it's like an open booking system on my website. There's not masses left between now and the end of the year, but you can sign up to get a notification, and it's a bit sporadic. But I've had a number of clients who've come in and out of those sessions over a number of years. So they might come for one session. They're 90 minutes, so you get a lovely long treatment from the therapists who are finishing their course. They get to really help somebody, which is very rewarding for them, and to see how effective the treatment is. And actually, even just a single session, we get fantastic results with reduction in pain, people feeling more comfortable in their scars, people going away knowing that they've been shown quite clearly how to massage their own scars. So if anybody's interested in that,
We
my
can put the
company's
link in
Restore.
the comments. Yeah,
Yeah, put that in. And there's a directory if you're in a position where you could afford some private treatment. We've got a directory of therapists around the UK, so you can find somebody in your area. And if you have anybody from outside the UK watching, it's not just limited to the UK. There are people around the world.
Great. I think we'll probably bring that to a close, because I think we probably could go on forever. I think there's one last question, because it'll be really quick. Where do you get the green silicone brush that you showed right at the very beginning? Somebody's asked.
So that was part of a set on Amazon that came with the little coney that came with these. So I got like a couple of those and that, and I think it possibly came with a bigger cup, which I want you to throw away or use on another part of your body where you haven't got a scar. But yeah, so yeah, but they have got some in boots. They're a lot more expensive in boots, and I thought they weren't as soft. I really like the soft ones, but they've also got some in TK Maxx every now and again. So have a look in TK Maxx, because sometimes you find in their section you can find some soft ones. And all of these things, the silicone facial cups, they're about £6 or £7, maybe less. And the set with the brush, I think maybe was £10. So none of it, ridiculously expensive.
Great. Brilliant. Well, thank you so much, Emma. That has, hopefully we have covered a huge amount, and certainly I think there's so much more that I think we could have covered. I know that when we advertised the session, we spoke about cording as well, but both Emma and me felt that there was enough to cover tonight, as you probably can see. And cording, I think we'll do another session on a later stage. So thank you so much, Emma, and good evening to you all.
Thanks, Louise.